Hi, my name's Tim Ria here with DigitalHealthLIVE at CES 2015. We are in the back of the room studio knocking out really cool interviews with folks who are just on stage. So we have Missy Krasner from Box.
Mm-hmm. Hi, great to be here. Yes, I'm the Managing Director of Healthcare and Life Sciences at Box.
Yeah, and I know Aaron, so it's good to see how big Box has blown up in the last couple of years. And one of our favorite companies, IdealLife, we have Darren Hay from IdealLife. How are you doing?
I'm good, Tim. How are you? I'm the Vice President, Sales and Strategic Partnerships for IdealLife.
Cool. I saw you guys at Mobile Health Summit.
We were there, actually, in a big way. Yeah. It was good.
So let's talk about your guys' background really quick.
Sure. So I've been in healthcare for about 20 years, and I actually was one of the founding members of Google Health. So I was at Google for 5 years trying to get their first healthcare product up, which was all about medical records and storing medical records online. Did 2 years in venture capital.
Which one?
I was with Morgan Taylor Ventures, so we did Practice Fusion, we did Doximity, HealthLoop, and we just recently did Vuex. And I got recruited over to Box about a year and a half ago. Box is starting to verticalize, so they're really focusing on different industries. We're HIPAA compliant, so we're selling to hospitals, large pharmaceutical companies, and also health insurance companies.
Awesome.
I think I've been doing the telemedicine healthcare thing for probably 23 years now, so I got you beat. But it was I've been doing it. Former TELUS VP in Canada, made the move down to Miami to join IdealLife about a year ago, and you know what? It's been a fantastic ride so far.
Yeah, and I love Jason Goldberg and his dad and the family. So you're hearing the next panel is basically, if you guys hear the noise, there's like 800 people here. We had to actually get a whole new room. So what was going on stage? What was the title of the subject?
Yeah, really what we were trying to focus on, I mean, there's such, I've been coming to this summit since it was actually launched, and there is such a sort of explosion of everything from, remote monitoring, medical grade apps, wellness, apps. And I think what we were talking about is how do you actually start federating and connecting that data? It's great that we have all these apps. It's great that we're actually collecting data remotely, but we're still not quite at a stage in the industry where we can actually get all the data from the clinical systems that are big enterprise systems and then figure out actually how to connect them into these devices and our wearables. IdealLife has actually done a great job at that, and I think they're a really wonderful model. I was actually the moderator of the panel, coming from a cloud-based company that's all about sort of connecting people. We're sort of doing that, but I think we have a lot of really interesting pivot times right now with HealthKit, what Samsung's doing, what Google's doing, all on their platforms. And we're sort of trying to figure out if user-generated data can actually start intermingling with that clinical structured data. Yep.
That's the big question.
The session was is data your new doc? And interestingly, I mean, as we discussed, I mean, it's a lot of data coming in, a lot of data that's actually coming in somewhat structured formats, but not really terribly structured formats. The challenge is really how do you take the information, how do you integrate it back into the EMRs, how do you integrate it in a way that both the doctors can use, but also that the system can use in a broader sense. So you're not just sort of treating the individual patient-doctor relationship, but you're talking about a patient-doctor relationship plus patient-doctor to hospital, to community, to providers. It's a much more rounded ecosystem approach.
Yeah, it's really interesting. And I saw some really cool demos with you guys have censored scales, the pill medicine cabinets, and all that.
We do. I mean, the basic stuff that we focus on is the chronic diseases, so COPD, CHF, diabetes. So all the things where you need a scale, Bluetooth scale, or you need a Bluetooth pulse oximeter or a Bluetooth glucometer, sending data wirelessly, and really in the simplest fashion you can possibly do it. I mean, this can't change people's lifestyle. It's got to be easy to use stuff that people can just do right out of the box. They pick it up. There's no learning curve. They start sending data to their doc, and it goes into the system. I mean, it's just as easy as that.
So, what were some other hot topics going on?
Yeah, I think some of the topics that we were sort of dancing around was there's a lot of government standards right now that have sort of promoted interoperability. We have some level of adoption. I actually worked in the White House and helped set up the first office. So
to help get data out of the EMRs and
actually make the EMRs talk to each other. That's the piece that they don't actually talk to each other across organizations. So I think one of the things that we were really focused on was sort of what stage are we really at? There's certainly the government conversation where they've pushed their standards, but private industry is still working hard to actually adopt them. There's this sort of consumer electronics wearable kind of remote monitoring conversation where that whole sort of workflow is working, but it's still a little bit isolated. And even when you get data back into the EHR, does the EHR have fields to accept that data and fully integrate it, right? So we're just not quite there yet.
Yeah, now I was working with the Fujifilm Sonos site on medical imaging, and there's all kinds of different, in the MRs they even have the fields. Right. How do you map stuff?
But it's a huge, that's the biggest challenge. Look at the challenge with remote patient monitoring, look at the challenge with all the data coming in. It's two things. It's return on investment, proving return on investment, so people actually pick it up and use it and wanted to use it. And the second is integration. If you can't integrate the data, then there's really no sense in collecting these silos.
Yeah, and how do you normalize and
well, and I think the other thing beyond what you were just saying, it's integration, it's ROI, but it's also figuring out how to actually denoise the data, and so that you don't have alert fatigue. And yeah,
that's a good point. Look at so our software has been created to do just that, right? Basically, you got all this data coming in. You got to actually take it. You got to structure it. You got to have it in a way that you're not just creating threshold alerts for anything. It's got to fall at a threshold. It's got to be logical. It's got to make sense. You got to actually sort of use it in a way that actually makes sense, makes the doc's job easier, makes the nurse's job easier, as opposed to just adding extra clutter.
I'm actually working with a startup called Event Enrichments that's working on just attenuating all the alerts just for like managing servers, but within our body and especially doctors, it's like just a barrage.
And doctors aren't getting paid to look at more data, particularly data that is, they don't have time. I think one of the things that is interesting at Box is, we sell to enterprises. We also have a free app that consumers can use as well. But one of the things that we're seeing at the enterprise level, particularly hospitals, is there's so much unstructured data in healthcare. I mean, this is everything from a radiology image to a care plan, right? And that data, no one really knows how to touch or do anything with that data, because if it's not living in an EHR with a system of record, how do you move it? How do you do something with it? And so that's sort of what we're touching and handling.
Yeah. We've kind of taken the approach of saying, let's figure out how we do the integration, how we actually move it in a structured format, whether it's web services or HL7. I think I mentioned the smart technology guys. Got some really very, very smart Harvard-trained technology guys that really get it, and they're clinicians. So they understand what they need and how they need it. And it's been a big difference for us.
I was working on a semantic search librarian for this 10 years ago, but that was a long time ago, so it's all about...
Still totally relevant, right? Yeah, we're still trying to crack that nut.
How do people connect up with you in Box?
Yeah, so basically, we have a healthcare and life sciences whole section on our website. I'm just Missy at Box, MISSY at Box. We are available to talk to anybody who's really interested in figuring out how to move data from point A to point B in a HIPAA-compliant way. And it's kind of exciting times. We've got, some really interesting things that you can build on top of our platform rather than just using Box. Anything from patient education all the way to, credentialing doctors at hospitals.
Very
paper-driven, and we're trying to get into a digital.
Very cool.
My biggest focus on my job, sales and strategic partnerships. As much as I like to say it's sales, it's really strategic partnerships. So looking for partners that we can actually work with to develop the space. The space is still developing. It's still relatively new. We want to make sure we can actually sort of build the right partnerships. So, we've done partnerships with ADT and Verizon and Sprint, and there's a whole bunch of them. So we're constantly looking to build that ecosystem and make sure we've got the right partners to take this, really make it big so we can actually start impacting both the patients and the providers and the health system overall. So if you're looking for a partnership, DHey at IdealLife.online.com. Absolutely happy to talk. This is a great forum. I think they've done a great job with the show, and I'd really like to sort of look at the partnership angle coming out of this, and happy to talk to everyone.
Yeah, this is a place to be to basically connect with everybody in the one spot. So Missy, Darren, thanks for being on the show.
Thank you. It's great to be here. Thank you to WebMD, who's sponsoring this studio, and also to Jill for having us. This is great.
Thank you very much, and then thank you to you for moderating. It was fantastic. I had a lot of fun, and it was a great show.
Yeah, you guys are awesome. Okay, thanks a lot.